Flying after diving. How long should you wait? The question about when is it safe to fly after having a diving expedition is a major concern for divers. During basic training for divers, they learn that they should not go flying right after diving. However, there doesn't seem to be a definitive answer on the amount of time. Diving and flying are both captivating hobbies that can overlap. Without proper planning, there can be dangerous, and even fatal results for flying after diving. It's important to consider the interval between these two activities. The major risk of flying after diving is experiencing decompression sickness. Decompression sickness, DCS, is a result of nitrogen in the bloodstream getting compressed while diving, then expanding as the pressure decreases when coming out of water. When you fly, there is increase in altitude while pressure around you decreases. So it takes longer for the body to flush out all the excessive nitrogen. After diving, the body should be allowed sufficient time to rid itself of excess nitrogen. There are two types of DCS. Type 1 DCS. It tends to be mild and affects joints, skin and lymphatic vessels. Type 2 DCS. This tends to be fatal since it affects vital organs such as the brain, spinal cord. Symptoms include nausea, vomiting, headache, paralysis, blurred vision, loss of balance, burning chest pain, swelling on surface tissues, and muscle weakness. Here are some authoritative recommendations on how long to wait before flying after a scuba dive. The U.S. Navy recommends that you wait for 2 hours before flying after diving. The U.S. Air Force suggests you wait for 24 hours. The Professional Association of Divers Instructors recommend at least 18 hours of surface interval after diving before you can fly. These recommendations are conflicting, and it may be hard to know which guidelines to follow. However, recently performed research has provided us with more information. The Divers Alert Network, DAN, recommends that the minimum pre-flight surface interval is at least 24 hours for single or multiple dives. This is based on the recent research study on cardiac echo in flight. This research was performed by Dr. Danilo Cialoni and Dr. Massimo Pieri from the Research Department of the Diving Safety Laboratory, along with researchers Professor Alessandro Marani and Professor Constantino Balestra from Europe DAN. This group performed experiments on what happens in the body of a diver during a flight. This was the first time in history this research was conducted successfully. In 2013, the research was presented at the EUBS, Europe Underwater and Baromedical Society Conference. The researchers studied the production of bubbles in the diver's bloodstream. No bubbles were observed after 24 hours interval time after diving before flying. Based on this evidence, the party agreed that 24 hours is a sufficient surface interval time after diving before flying. During the analysis, they discovered 3 categories of some divers. Some who do not develop bubbles, some who occasionally develop bubbles, and some who developed bubbles after every dive within the 24 hours interval. It is advisable for some divers to extend their time before flying to even 36 hours. The research reveals too that shorter duration of flights after diving poses greater risk than long duration flights. This is because the altitude for aircraft pressurization for shorter distances is higher for shorter destinations than for longer destinations. The above guidelines direct the minimum amount of time any sports diver or recreational diver should wait to fly after diving. This acts as a safety guideline but does not guarantee that you won't get decompression sickness. The longer the interval between diving and flying, the lower the chances of decompression sickness occurring. Practical plans should be put into place to maintain your safety while scuba diving. Take simple things into account. For example, plan for an extra day of resting after diving before flying. You do not want to have a life-threatening disease just after an exciting vacation with family and friends. For sport divers, invest in buying a dive computer that will give you accurate information. The dive computer calculates the time to fly, based on diving depths, time and number of dives. They should also consider fatigue, dehydration and general body fitness. Always consider your health safety before anything else before and after diving. We hope this information helps you in your scuba diving journey. Please consult your physician about the information contained in this video. If you enjoyed this video, then please leave a like and subscribe to our channel. Please post any thoughts you have in the comments. We look forward to seeing you on the next video.